Did the president take back at least some control of the healthcare message following this town hall meeting we've been covering?
Let's ask our star-studded panel. We have Jerry Seib, he's executive Washington editor at the Wall Street Journal. Dr. Erica Schwartz is medical director of health insurance provider Synergy Health, and Republican Congressman Michael Burgess of Texas, who is himself a medical doctor. He joins us now from Ottawa. Representative Burgess, I'll go to you first. Basically, it seems to come down to trust. Do the American people trust the United States government to create another bureaucracy, which is what the public option would be? And it looks like the president is still losing that debate. Did he turn things around at all moments ago?
Well, I don't think so. And, of course, you're right. It does come down to trust. And congressional approval ratings right now are so low that people don't trust us to do half the things we say we're going to do. And, unfortunately, the last 6 months, you've seen us take on an enormous amount. And what we've seen in our town halls this summer is people are pushing back against that. The takeover of the automobiles, the financial industry, the cash for clunkers, which really didn't turn out quite as anticipated. So people have a lot of distrust of the United States Congress. Now, the president does, of course, still enjoy a significant boost in the popularity polls, so he does have some political capital to spend. Congress doesn't, and I think this is what's been obvious to me these past couple of weeks.
Well, let's get to Dr. Schwartz. You, too, as a physician, have some real opinions on what would actually work. Clearly, you believe, Dr. Schwartz, that there has to be at least some type of change, but that what the president is doing is missing the mark. What should he be aiming for here?
Well, I think that, first of all, you're looking at the fact that the president has made a deal with the drug companies for $80 billion over the next 10 years that nobody's talking about. The New York Times spoke about it. We've been talking about it, but not enough. The public doesn't realize that he has already made a deal with special interests. The drug companies are actually running the healthcare system, and here they are making a deal. They're capped at $80 billion. Nobody can go after them afterwards. That's not okay. Tort reform, nobody's talking about that. Physicians don't like to practice medicine defensively. They would like to work with the doctor-patient relationship, at improving the doctor-patient relationship, and we can't because there is somebody else between us.
The lawyers.
The lawyers.
Jerry, let us talk about what we just saw, which was the president. There was a change in tone, certainly from what we saw last week, where Nancy Pelosi and the president's office were both deriding the protesters. You didn't have that attack. In fact, you had sort of a more conciliatory mood. Is that because the polls, the most recent one by Rasmussen, show that the public more than ever is opposed, at least what they know of the congressional plan?
Well, look, you're bound to have a more decorous setting when the President of the United States was involved, and so you had a little more respect going both ways in that setting. But nonetheless, I think all the tough issues got raised. The public plan, the cost of the plan, the question of what exactly the role of the end-of-life panels would be. I mean, all the things that are driving the debate were at least put on the table and were addressed. And, you know, my sense of this is that President Obama is still the best spokesman the Democrats have. I think his basic problem is that there is not really an Obama plan. There are 3 or 4 congressional plans, and he's forced to justify or defend or support just about every element of all of those plans. I think that this is getting to the point where the White House has really got to say, here's what we're for, here's why, and this is what we'll defend, and there's some other stuff that we'll let go. Just a final point, I was listening for the president to back away from his support of the public option because some in the White House think that may be where this is headed, and more importantly, some people in Congress on the Democratic side think that may be where this is headed. I didn't really hear that today, so we'll see if that emerges later.
Representative Burgess, what are you doing with bipartisan help? I know some Republicans are speaking with some Democrats coming up with ideas. What are you doing on your side to kind of try and bring some semblance to this situation?
Well, I think the critical thing that has to be addressed, and the president did talk about this, those folks with pre-existing conditions who can't get insurance at any price or the price is too high for them to afford it, yes. That 8 to 10 million people is where our energy should be concentrated right now. And if we could begin to fix things there, perhaps we would get the credibility back that would be necessary for us to tackle other problems. And on the issue of tort reform, absolutely, that was the first amendment that I introduced in our committee. It was knocked down on a technicality. I brought it back again. It was defeated on a party line vote. But let's face it, if we don't give doctors some measure of protection, we can't ask them to be our partners in this.
Dr. Schwartz, the notion that public government insurance program or government insurance company would crowd out private insurers. Is there any legitimacy to that argument?
I'm not really sure that that's true. I think that if it's done well balanced, I mean, look at Medicare and Medicaid. They've been around forever. They've not exactly proven the government to be really efficient at making healthcare better.
Not when there's $60 billion in waste.
I mean, all the doctors, everybody's trying to run away from them. But maybe if we want to give it another chance, reconfigure it, fine. But that leaves a lot of room for private sector. And I think that if you bring them together, you're probably going to do a lot better.
Doctor, do you think that the insurers, that they are part of a huge problem, just as Representative Burgess discussed, saying that they refuse to take on people with pre-existing conditions? If we focus solely on that, could that be a good thing for
I think absolutely. You know, Synergy that I work for, it focuses on prevention and focuses on people don't have, you know, nobody cares about pre-existing conditions. So that's actually true. But you know what? That's only, like he said, 8 to 10 million people. We're talking about a lot, 47, 50 million people at this point.
Dr. Erica Schwartz, great stuff. Thank you very much. Michael Burgess, thank you for joining us from Ottawa.
Yes, sir.
And Jerry, always a pleasure to see you. Thank you very much.
Thank you.
Thank you.
Well, stocks headed south today.